The world is experiencing a disruption to the global supply chain due to the COVID-19 pandemic and geopolitical crisis that has now affected medicine supplies. According to Azrul Mohd Khalib, CEO of Galen Centre for Health and Social Policy, this is not a time to downplay the seriousness of the issue, as it may worsen over time.
So what we're seeing actually is a reduced levels of stock for certain medicines used in the treatment of medical conditions like respiratory ailments such as flu and cough, as well as like paracetamol for fever. So this seems to be at the moment limited to private hospitals, GP clinics, and private pharmacies. To basically some extent, what we're seeing today was expected due to the ongoing COVID-19 pandemic, because it's still not over yet. We are concerned right now is the classification of other drugs, which is seemingly being affected by the ripple effects from the geopolitical scenarios, such as the Russian-Ukraine armed conflict and the lockdowns that have occurred in major industrial and port cities in China. So what we're hearing right now, and this is anecdotal information from people and patients, is that drugs used to treat conditions such as ADHD, attention deficit hyperactivity disorder, and even Parkinson's disease are limited in stock. So this has forced some people to cross state lines to look for their medication, and this is something that is very worrying. And we've already heard from, I think, KJ just the other day, confirming that antibiotics are also something of short supply right now. And antibiotics are more likely than any other drug to be in shortage when it comes to consumption.
Therefore, preparing further medicine and pharmaceutical supply shortages must start now. Azrul said while the geopolitical crisis and other problems affecting the global supply chain may be out of our hands, Malaysia can explore rationing supplies at home to ensure adequate stocks.
In the long run, we are looking at a possible disruption of between 6 months to even a year for certain types of medication and pharmaceutical products. So right now, what we need to be able to do is to start thinking long-term, perhaps even rationing some of the high-demand drugs. We certainly probably cannot afford anymore to give drugs like 1 month's worth given in one visit. And perhaps it needs to be rationed to maybe 2 weeks worth. And this is to avoid a situation where we run out of certain drugs that would cause doctors to prescribe suboptimal treatment. So we need to make sure that there's optimal treatment for the different diseases and that there's enough drug supply. And to ensure that happens, we need to ensure that we have enough drugs. So the government has probably got to already start thinking about rationing some of the drugs used for cardiovascular disease, hypertension, maybe even diabetes, looking at planning for disruptions to occur all the way up until the end of the year.